Hey, thank you so much, Susan, and thank you so much, Zomedica, for sponsoring this important discussion today. I know you guys are busy, and whether you're watching this live or later archived, I really appreciate you spending some time to talk about a topic that really is more new than old, and that is really how do we get endocrine testing in our clinics during appointments. And that's really transformative. Throughout most of my career, I've really focused on a couple of key areas. And many of you know me for my work in obesity, but really that was out of senior care and longevity. Those are all issues that are related to hormones in the body. And so it's really exciting to bring you new technology. Quite frankly, groundbreaking technology that's unique to the medical space. And Zomedica and Trueforma are really leading the way. So I want to thank them so much today for their participation in this topic. I do want to start off, by saying there's a lot going on when it comes to endocrinology. When I look at all of the areas of active research, wow, there is so much going on here. So today we're actually going to be announcing two new biomarkers that Trueforma, Zomedica are bringing to this platform. And guys, I expect to see more and more. When you look at what changes are happening in basic foundational sciences around hormones in animals, especially the small animals that I serve, it's groundbreaking. And again, this is not unique to dogs and cats. This also has tremendous applications for our equine practitioner colleagues out there. And so, I do a lot of work with obesity in horses. And let me tell you, this is just music to a lot of folks' ears out there. I do a lot of stuff. Again, you know me from my work in obesity as the founder of the Association for Pet Obesity Prevention and the World Pet Obesity Association. I have a textbook coming out sometime at the end of this year, early next year from Wiley on veterinary clinical obesity, which I'm very, very proud of. It's an amazing international roster. Every week, I've been, for the last 9 years, over 9 years, Becky Mosser, a registered technician, the current president of NAVDA, and I do a weekly podcast called the Veterinary Viewfinder. Again, you can just click on one of those QR codes, put on up your phone, and you can go and listen to our latest episode there. I also write the monthly column, the very first column in today's Veterinary Business, called Opening Shots with Dr. Ernie Ward, where I take really some of the big dilemmas that we're facing in practice, right? Whether it's our personnel, whether it's services, whether it's clients, I really tackle those big topics and try to give you some advice on how you can make your practice a little better. So I want to kind of talk about what I hope to accomplish in this short period with you today. And that's really number one, to allow you to discover about how in-clinic endocrine testing can really change the way you treat patients and improve our patient outcomes, quite frankly. But I also want us to continue to focus throughout today's discussion on adding new services, because I think that's one of the biggest barriers that our colleagues have, right? It's like, okay, there's some new, amazing, great things out there. I don't know how to get my team excited about it. I don't know how to sustain momentum behind it. I don't know how to see if it's successful or not financially or whatever. And so I really want us to continue. I'll keep peppering today's talk with how you affect change, because I think that if we're not really strategic and intentional about adding new things, then sometimes we get lucky and we win, and sometimes we don't. And guys, there's so many new drugs, so many modalities, so many tests that are coming out that we really owe it to ourselves as scientists to really dig in a little bit deeper sometimes. So again, I'm going to be talking a lot about change today, which I'm super excited because that's what I like to do. If we kind of boil it down to what do, we serve pet parents. Obviously we serve the animals, but really we're serving the pet parents first and foremost. And we have to understand pet parents have certain wants, needs, demands, and then they deserve a lot of stuff. And I kind of want to break it down as we start off today's discussion on really adding new services and why hormonal testing can really change your practice. Let's focus on those wants, needs, demands, and what they deserve. And so I think we'll kind of start off with the big things: convenience, compassion, expertise, and value. And so if we start to dig that down a little deeper into convenience, well, we start to come up with, okay, the obvious markers, right? Location and hours, like, the if you're close by to someone, convenience, right? If you're open when they need you, that's convenient for sure. But there's more to it than that, because technology can help us with convenience. And really, this is online portals, whether it's a store to pick up, commonly frequently bought drugs or heartworm preventives, flea preventives, food. I mean, technology can help us, but more importantly, now we're able to, you know, communicate with the client more directly. I mean, we can get video from the home of limping or abnormal behaviors or concerns. I mean, technology really does add another layer, a deeper, richer layer of convenience that I think we're not talking about just enough. But really, when it comes to convenience, people want it done now, right? I mean, that's really the driver of convenience, whether it's location, whether it's your hours, whether it's the availability of virtual or online services, it's now, right? People have this urgency and they want their thing fixed, right? They want to be able to do whatever it is they want to do now. And we have sort of catered to that in our society because, you can Instacart anything. I mean, you can get your stuff delivered, and I'm not saying that always applies to veterinary medicine, but it does apply to the demands and wants of our clientele, right? They also don't want to shop around 5 different places. And that's something that, if you go back and read what I was writing about in the 90s, we were really trying to capture that. We knew that when we had those folks in our clinic, we wanted to optimize that experience. And that meant also being able to provide them with preventives, with food, with toys. I mean, so, at that time, and I still am a big fan of retail sales. Now, obviously, it's got to match up with your own mission, and what you're delivering to the public. But at the same time, if you're a single source solution, that is a big convenience factor for most pet parents out there today. Also, being able to answer those questions quickly, and today you're going to continue to hear me talk about urgency and being able to immediately answer. And really, endocrine has been that black hole, right? We've traditionally had to ship these off, and we've waited 48, 72, 96 hours for an answer. And look, I'm not going to say all these are urgent, critical cases. Most are not, but we know that if you start to delay results and action, you're disappointing many, many pet parents because, again, they want it now and they want it quickly for sure. Also, we've got to be mindful of managing our time, but also the client's time. And today we're going to talk a lot about this results loop and how that, we can measure ourselves and go, oh my gosh, I've spent, 30 minutes dealing with this situation. Well, the pet parent has too, right? They've spent an hour, maybe more, driving back and forth or waiting or answering emails. I mean, there's a lot going on. So when I talk about convenience, I'm saying, how can we solve it for that person in that one step, or at least as few steps as possible? And this results loop really does, it's a time suck, guys, for our staff, for our clients, and ultimately for our patients, because we may be delaying needed treatment. And again, in the endocrine space, many times these aren't urgent. I mean, an Addisonian crisis, notwithstanding, but we are talking about a situation where, okay, it's been a slow creeping, insidious onset, and suddenly now the owner takes action and they don't want to delay. So there's a lot to kind of speed of results for sure. Our clients also need, want, demand, deserve our compassion. And so we have got to, as veterinarians, make sure that everything we do is completely empathetic. But compassion without expertise is a bit of a half offering, right? I mean, we can do better. And so when we start to look at being the best veterinarian that we can be, providing the best service for the patients that we love, well, then we've got to do a better job, right? We need to be experts. And again, just my own career path has led me down a lot of discovery into, hormones. And so for me, endocrine is an area of excitement, intense excitement. And I kind of want to lead off with what I think, what got my attention when Zomedica first brought out the Trueforma platform, and that was their free T4 assay. Because for us, we were not able to do this. This was of the domain of the, labs. And so for me to be able to send something, to be able to do something in 20 minutes that I used to have to send off to the reference lab and take a day, 2, 3 days to get the results, just was completely transformative for sure. It also gave us that void, right? It closed that gap between this thyroid assay, because we could do a total T4 in clinic and rapidly and reliably, but that was only half the equation. And so for us, a lot of times we would sit there and have an equivocal or maybe even a low total T4, but we didn't know if truly the dog or cat had disease. So we're going to talk more about why that's important. And again, this is in minutes. We're no longer held to the standard of, well, I'll get you those results as soon as possible. Hopefully, we'll get them by tomorrow afternoon. You can literally say, if you've got 20 minutes to wait, I'd love for you to stick around so that we can get some answers and start to take action today. Those two conversations drive adherence to our recommendations. Very, very, very important sort of point for sure. So again, I love this. And if you kind of look right now at where Trueforma by Zomedica is in terms of time, you can see on this chart that they've provided that, yeah, it's less than 20 minutes for all of these assays. This is very, very, very important to me because, if I'm sitting here going, wow, where am I in my caseload? I'm busy, we're overwhelmed, we don't have enough folks to do the stuff. I can't now sit there and have somebody tied up for, half an hour or more just doing this one thing. Well, these are so automated. It's literally drop it in, put it in, and walk away, and the results will beep at you in a little bit. And I mean, this is the kind of speed that we need, right? And I remember talking with the Zomedica folks right before launch of the Trueforma. And I was like, well, it's got to be less than 30 minutes. They're like, Ernie, what if I told you it's less than 20 minutes in many, many cases? And I'm like, you got me. You've got my attention for sure. So speed is really important to me in a busy vet clinic. If we kind of look at the current roster, and again, as I mentioned in the prelude, this stuff grows. Like this type of technology, this bulk acoustic wave technology lends itself to a lot of interesting biomarkers. So, I'm kind of excited about what Zomedica and Trueforma are working on for the future. But right now you can see we have a pretty complete list. Again, super solid on thyroid. I love cortisol. I think this is one of those areas that, at least in small animal practice, we don't do it enough. There are a lot of good reasons, and I'll share with some of my reasons today. But of course, the horsey folks, they already know all about cortisol, super important to them. ACTH, again, same thing. We have it for dogs and for horses. But then you start to look at these other assays and you go, wow, this is getting very interesting. And you'll notice the last two here are brand new additions. This is 2025 updates where we now have NT-proBNP for dogs as well as progesterone, which is, again, a lot of folks that work with breeders know how needed that is, especially in an affordable, fast fashion, which leads us to that last thing, right? We talked about convenience, talked about expertise and compassion and all that stuff. But at the end of the day, if we're not delivering value to our clients, right? And that's why I said at the beginning, we serve pet parents. If we don't deliver value to them, and again, there's a lot of ways to measure value, but at the end of the day, it's you got more than what you paid for. That's a positive value, right? So we've got to do that. And I will tell you guys, in today's world, we are kind of taking some steps back in client service, just in all sectors, but you can really wow people these days by saying, no, we can do that right now while you wait. People are sort of baffled. They're, what? You can do that now? You don't have to wait and go to my chart portal and all that stuff. And people love this stuff for sure. So when we look at value, obviously pricing is part of that. And this is where Trueforma by Zomedica really shines, especially when you look at things that you're going to be doing frequently, like the free T4, when you're running those thyroid panels. And really the cost to run, once you kind of talk to your Zomedica or your distributor rep, and you start to look at what your volume is and how many you're going to be buying and so forth, you're going to be very impressed, as I've been, with the pricing on this. This is stuff that's very affordable, and it's something that I can't make an excuse for vet clinics anymore. It's no longer a cost barrier to the implementation of that. Again, we got time to results super fast. In clinic immediate. I mean, all of these things really do sort of beat it. And we're going to share with you too how bulk acoustic wave matches up to ED. So if we're trying to figure out how we want to test for these things, equilibrium dialysis has been the gold standard. Well, it matches up. So this is really interesting. So for me, this checks a lot of boxes. But I want to go back as we sort of now say, okay, there's some stuff out there and everybody gets it. We got to be, convenient for folks, give them good results in a, timely fashion, creating value, be experts and be compassionate. But here's the thing. Again, the barrier is change. I mean, change is hard at all levels, but in a vet clinic, a busy vet clinic where you've got an established workflow, your appointments go this way or that way, adding something like this can sometimes be a bit jarring. And, I think that vets often buy things, whether it's the latest drug, whether it's the latest test, whether it's the latest, whatever, piece of equipment, they typically do this based on emotions, right? I mean, this is why salespeople get paid a lot of money. I mean, I'm going to be frank about it, and so we've got to, as scientists, sort of sit back and go, okay, should I make this purchase? Oh, wow, this is so exciting. I love what they're doing. The bells and whistles are appealing, right? And it looks like it's affordable. All those things really are meaningless unless we start to go through some basic exercises. So some of the things that I do, and I'd like to share with you how I come about these, is I ask some certain questions about anything before I add it into my clinic. Number one is, does it fit within my clinic and client culture? There are some amazing products and tests and equipment out there that just don't match up. And I used to use the color flow Doppler ultrasound when those things first got popular. Okay, so I'm dating myself a bit, but there was a time when that was a new thing. And suddenly now veterinary clinics, busy, good veterinary clinics, were faced with this opportunity to spend 40, 50, $60,000 at the time, which, double that almost these days. To bring in this type of technology. And I remember kind of going, oh my gosh, this is a big spend for a lot of vet clinics. Do they need it? And I used to challenge these vet clinics. I used to say, look, do your clients want it? Does your current caseload support it? Like, are you already maxing out on radiology, for example? I mean, are your cardiac workups just like, a month of waiting, right? And suddenly you start to realize that, wow, it doesn't work in every context. And, if you fast forward a year or 2 years later, for some of those people that bought those devices, I mean, those were very expensive lab coat hangers, and you know exactly what I'm talking about. So the first thing we're going to do is say, does this match up? So if you're looking at Trueforma, do your clients, are they tight on time? Do they need to get those answers at that one visit? Are they interested in that next level, right? Do they do the follow up? So suddenly now they're not just vaccination, spay and neuter, ear and skin problems. These are people that, by and large say, no, I really want to find out why my dog is vomiting. I just don't want something to stop the vomiting. And that's that culture, right? And there's no right or wrong answer here, but my advice is you want to match this up with what's going to succeed. And, the people at Zomedica, which is interesting, you would think, well, here's Ernie, and he's saying this isn't for everybody. I mean, I'm sure Zomedica wants to sell to every vet clinic. They really don't, because they want you to succeed. It doesn't do them a lot of good just to place a box somewhere and never get any utility out of it, right? I mean, even just in sheer economic terms, Zomedica wants to put these devices in a clinic where it's going to be utilized, optimized, maximized. I mean, that's whenever they actually have the most success financially and certainly as a reputation. I mean, so does it fit the client culture? The second thing is, do you believe in it? Does your staff believe in it? And when it comes to the types of tests we're doing today, which are endocrine testing, is that an area that you're comfortable with? Because there's a lot of vets out there that, quite frankly, whenever you start talking about even thyroid disease, but certainly with cortisols and ACTHs, they just sort of go, that's kind of the next level that I'm not super interested in. Again, I think you should be because I think it's foundational. But, you've got to make sure that you believe in this type of technology, that you are the follow-up, the next question. What's the next test I can do to determine, precisely what is happening with my patient, right? Again, it's got to match up with the culture, but then you have to say, you know what, this is an area that I'm very interested in, and I believe that it's important. And now we're kind of getting back to this other question. Do your clients want it? And I know that culture and want sound like the same thing, but they aren't always, right? So you can live in an area that suddenly, where the people are primarily seem to be only interested in one lower quality of care, but yet you might have enough that really would want that. So you've got to kind of dive down deep and analyze and evaluate, your spend. And one of the ways I tell people to do this is, you really want to plot out. And I've written about this, many, many times over the years, but a simple exercise is just to look at, revenue per client per year. I mean, it's that simple, right? And you can break it down into pet, but I really like to look at my clientele, and you'll start to see that the distribution curve is probably skewed far to the left, meaning that you have the smaller number. There's a high peak that spend a lot of money, and then you have this long tail of so lower. And where the area under that curve can actually help drive some of these decisions. So again, if you just want to do some basic math, you can actually get some insights into your clientele that sometimes, we kind of forget. And then finally, is this a good investment, right? I mean, is this something that's going to make me money? Again, these are forecasting and modeling, and this is why, again, getting very comfortable making business plans with stuff like this will just accelerate your ability to make these decisions as you move forward in your career. But an investment can be, you can define in a lot of ways, but for most of these types of expenditures, I'm saying, how am I making money on this within 3 years, right? And so you need to have a plan for sure, because that leads us to the final thing of adding new services is that implementation strategy, right? So how are you going to roll it out? How are you going to train your staff? How are you going to promote it to your clientele? And then finally, how are you going to track whether or not you're succeeding with this stuff? All of those are basic tenets of any business plan. But I really tell vets that the more you do it, as someone who's been doing this for 33 years, it really does become easier. It really does make a lot of sense. And I'll tell you, the veterinarians that are most successful, in my experience for sure, are those folks that do these exercises. These aren't just pointless, and they're not just didactics. These are real. They have real impact on how you actually will practice how you will practice veterinary medicine and how successful your business will be. So I want to start off with where I think Trueforma's strength lies, right? And this is the foundation of this company. I mean, this was that area where you go, oh, wow, when we can pull off free T4s in the clinic at a very affordable price in very short amount of time, this is something we need to pursue. And I'm sure that's exactly what Zomedica was looking at when they saw this technology emerging. They're like, wow, okay, this is interesting. I mean, they're using it in the human field, but wow, can we bring this over to the vet med field? And of course, they've done a fantastic job. So if we look at the traditional workflow, okay, and I'm going to share with you kind of just in simplest terms what it looks like whenever it comes to, how would we diagnose hypo or hyperthyroidism in our dog and cat patients, right? I mean, you do an exam, you have very, very important, you have a clinical suspicion, right? So something about that case, typically on a physical exam finding, is the thing that says, aha, this Dotson might be a candidate. This could be looking like a hypothyroid case, just whatever, right? So then you go into what I call the diagnostic negotiation. I'll elaborate on this in just a couple of minutes, but we do have to get the client to accept diagnostic tests. I think I hate it sometimes when people like say, oh, I was suspicious of hypothyroidism. We ran a free T4 or whatever we did, right? There was a big step that you left out, and that is actually talking, communicating, convincing the client to spend the money, take the time to actually pursue this. So I'll drive in a little bit more on the diagnostic negotiation, as I call it, over all these years. At that point, if you did some of these endocrine tests, you had to send it out to the reference lab, right? And this is where it all starts to fall apart because you've lost the immediacy. You didn't solve it in one stop, right? And again, there are plenty of times when it's wholly appropriate, right? But for a lot of these cases, the quicker and the closer the client is to solving the problem, then the more acceptance you're going to get of that recommendation, right? So that diagnostic negotiation, which we're going to talk about in just a second, part of this is, well, when do I get the results? When do I find out? Nothing is more frustrating to a person to be on hold for something that they now are concerned about, right? So you go to your own human physician's office, and doctor says, yeah, I'm kind of worried about this, but I'm going to order some tests, and that'll give us a lot more clarity on whether or not this is something to be worried about or not. Well, guess what? You're worried sick about it, and you're worried sick about it until those results come back. You hope those results come back quickly, because otherwise you might have a week of sitting there, just in misery, worried about, oh my gosh, what's the test result going to be? And you're constantly going back to your portal. I mean, we've all been there, or many of us have been there, or maybe it's just me. I don't know, but I do know that gap, that delay can create anxiety, and more importantly, can just lead to more no's. You then get the results back. You got to call the owner, then you got to initiate the treatment, then you got to do the follow-up. Follow-up's got to go back to the reference lab, call the owner, and you can see. And this is where I call the results loop, right? There's two big loops here that you can get stuck in. And I don't mean you're stuck forever, but you kind of are, because, you're going in these circles of, okay, bring it back in. We're going to take the blood. We're going to send it off. We're going to wait a couple of days. We're going to get you back. We're going to change something. You're going to come back. I mean, these cycles really do become cumbersome, right? I mean, this is a lot of work for a person. And I do think when we look at numbers historically, especially over the last 20 years, you look at like adherence to chronic medications and chronic care. I mean, you classically see, I used to call it the 6 month slump, but in most of these cases, whether it's osteoarthritis, cardiovascular disorders, even some of the long-term derm cases, these patients are treated pretty well for about 6 months, and then they start to fall off the cliff and they just don't come back. And there are a lot of reasons that we don't have time to go into today, but we want to make it as frictionless as possible. And this is where these results loops are just one more little bit of sand in the cogs that slow it down or ultimately can wear it all out. So if we can do in clinic, we start to cut through these loops and just get right there, hang out for 20 minutes, or even that, and now we're going to get the answers today. And that really is so satisfying to so many people. Now, of course, you can call that person later that afternoon. They don't, I had a vet say, well, I have clients that say they don't want to wait around. Fine, right? That's their choice. But imagine you're giving them that choice. They are actively deciding to delay. That's fine too, right? That's a very different proposition than saying you must delay. You will not get these results back today. Versus, you know what? Hey, can you call me guys later today? Even that is quicker than what you proposed in the original, but we want to be mindful of that. Now, I want to get back to that diagnostic negotiation because nothing is more frustrating as a veterinarian than to know with almost absolute certainty, based on your experience, that this dog or cat has a certain condition. And you know that all you need is a couple of confirmatory tests and then you're off to the races, right? But you got to get buy-in from the client. And so no matter how convinced you are, you've got to convince the client that you're right and you want to pursue this testing, right? And this is one of the areas why we have done a lousy job with wellness or senior care testing, in my opinion, because we are so driven to get an answer that is, diagnostic for disease, which is basically a bad result, that when we get a good result, we don't even know how to handle that. So that's a whole nother separation. Maybe Zomedica, maybe we can come back and talk about that, about how we can promote wellness care, because, again, that's something that psychologically, there are a lot of little levers you can pull that most vets just don't. And those of you that have been with me for the past 20 years, you know some of those things those tenets that I espouse. But the diagnostic considerations here for me, when I'm negotiating, I'm going to say, okay, based on my physical exam findings, I'm concerned about, hypothyroidism. Let's just stick with that example for now. And the great news is, we can test for that while you wait today. That already is one of those decision-making factors that the client's like, okay, so I'm not going to have to wait a long time. So now it really becomes one of, is it affordable? And do I value this? Do I believe that this is significant and important in my life and I want to choose it? And that's you've got a great start, because if they showed up with a pet for anything, there's a deep bond and love. So you already have that tipped and tilted in your favor. And so now you just got to create the value. And part of the value proposition is timely results. And so you've beaten that one down. And so now it kind of just comes down to as I used to call it, a checkbook box, right? I mean, can we afford this or can we not? And some clients are going to be able to, some are not. I mean, that's a whole nother discussion in and of itself, but you've really eliminated a lot of the traditional barriers to pursuing diagnostics just by saying we can do it right now while you wait in our office. Now, the one thing too, TRUFORMA is going to be less expensive, almost across the board than sending it out to the reference lab. I mean, I think time is the big lever to pull, but also just remember that when you start to look up dollars and cents, if you're charging, and I've cautioned vets, and I'm not going to get into pricing strategies today, we just don't have time, but the reality is, you should not, in my opinion, charge the same that you would send off to a reference lab, because if the barrier in your area, the client culture, your clientele are looking for, lower cost, and who isn't these days, you can offer the same degree of testing with the same precision and accuracy as a reference lab at a discount. And that is valuable, guys. So, again, I'm not against, being price competitive, especially on things like this when I want to do more endocrine testing, me personally. Now, clinical suspicion. That's what actually led before the diagnostic negotiation. But I just want to explain to you how sometimes just cutting through those results loops can actually, speed up the negotiation process, so to speak. But you got to know what you're looking for. And this is really where Zomedica shines, because if you're in the endocrine game, and I'm going to share with you at the end of today's talk, they've got a wealth of resources for veterinarians, veterinary technicians, support staff. I mean, so there's nobody that they can't help educate you on. So, and I really do encourage all members of your team to sort of know the basics, especially of conditions like thyroid disease, for example. Okay. And we'll talk about cardiovascular disease just briefly today. But, when it comes to things like canine hypothyroidism, I mean, come on, weight gain without, an extraordinary increase in their appetite. In fact, most people say, hey, it's maybe the same or down, and they're gaining weight for sure. Lethargy, cold intolerance, dull, dry hair. I mean, you guys know what to look for. In fact, this isn't designed today to say, hey, this is how you diagnose hypothyroidism or hyperthyroidism or anything. Our goal today is just to say, look, you already know intuitively, you've been taught, you have experience. We've got to streamline the process, get out of these results loops, be able to give more, value to that immediate results. That's really where this stuff starts to shine for sure, And again, when you start to look at some of the stuff that True Forma has put together, I gotta give my hat to these guys. I mean, Zomedica has really put together some very fresh, modern, easy to understand resources, both for your team, yourself, and your clients. So I encourage you to go back and really look at some of their stuff because they really do a great job with sort of communicating that. Now, a lot of us are familiar with how we diagnose, for example, hypo and hyperthyroidism for sure, but we really do kind of focus on the low, low, high, right? I mean, that's how I was taught when I graduated in the Stone Ages, for me, but we really need to focus on these kind of gray areas. And these are the areas that I really think, this type of testing can shine. And this is why just doing a total T4 is really not helpful. And I will argue there are a lot of situations where even a total plus a free T4 are inadequate. And again, you can see clearly from this chart here how just distinguishing between the TSH can really help us in our diagnosis. So I think that we kind of got locked into a period of time where we go, oh, it's a low, low, high. And it's like, guys, that's the easy one. You really want to do these three tests because you want to get these other categories for sure. And again, I think it's very important to understand sort of how these hormonal feedback loops work, and then sort of why those test results are the way they are. Again, when we're looking at hypothyroidism, they have tons of elegant algorithms that you can use to follow. And I really like these types of charts in the exam room. Like this is part of my, like let's say I've got that client and I do want to go ahead and push it. This is part of my diagnostic negotiation. I like having these handy. I like circling things. I mean, you can tell already from this presentation, I like making notes and symbols on paper because I do think it helps anchor that conversation, helps keep them present and focused. And so I like having access to these kind of resources. It really makes a lot of sense to clients. Sometimes they just want to know that there is a logic to what you're doing, that you're not just upselling them and ripping them off, right? And so that you go, look, this is science. This is how medicine works. And here's what I want to do next. And you can see if this comes out this way, we go to there. I mean, clients appreciate that. So don't undervalue this, especially, if you're kind of new to this. I encourage all young veterinarians to really get in there and do some show and tell because it makes a big difference. Now, obviously, a clinical suspicion for feline hyperthyroidism, I know everyone watching this is going to be very, very capable and competent with that. Again, these are typically older cats. They're losing weight, have a high heart rate. I mean, you guys know this. The problem is it's underdiagnosed, right? I mean, it's one of those heartbreakers because a lot of times vets will say, yeah, I had this 4-pound hyperthyroid cat case come in last week. And you're like, wow, we got a gap to close there, my friends, right? As professionals, we need to do a better job of educating the public on what to look. Clients should not be waiting until 4 pounds before they say something is wrong, right? Now, look, there are always going to be exceptions. There are going to be people that are negligent, that don't have the resources or even care and concern. That's a small, tiny percentage, right? The vast majority of our clients are like, I really didn't even know. I mean, I thought she was just getting older, and I thought, they kind of all look that way. We can do a better job. And again, this is a great opportunity when you're promoting this stuff. I talked about those 4 tenets of how we kind of get in there. It's like, how are we going to promote it? This is one of those things, again, raising awareness amongst our clientele for sure. When we look at it, this is a fascinating study. And again, these links are all, you can kind of get them off here. And I'm sure the good folks at Zomedica can provide you with whatever resources. But this one came out last year. And I think it just bears repeating a little bit. This was an interesting case because they basically took these cats, and they wound up with 201 that were confirmed to be healthy. But they have 259 cats. They said, okay, we want to screen them and we want to see who's healthy, and that's our cohort. And then we're going to follow them over the next 2 years, right? So the first 259 cats, 21% of the apparently healthy cats were diagnosed with either stage 2 renal disease. Hyperthyroidism was 4.6%. Obviously, I'm going to highlight about overweight and obesity, dental disease, and abnormal cardiac excultation. So basically, they take them, they say, okay, here's the ones that we thought were healthy, but they actually turned out to have an underlying condition. This is where it gets a little more interesting to me, though, right? So they follow them up, and within 2 year period, those that were screened normal, right? So not just physical exam findings, but they actually went through it. They tossed out the ones who, wound up having an underlying comorbidity or morbidity. And then within 2 years, 28% of a mature adult, and they broke them down into some age ranges, and 54% of senior cats were all confirmed healthy at the beginning, developed a disease. Obviously, it's going to be kidney disease is going to be the big one. But remember, this 2 year period, right? So go from nothing to stage 2, and then 8.5% were developed hyperthyroidism. And that's really an interesting study because it shows you, number one, the incidence, right? So this is telling you this stuff happens and it's not infrequent. 8.5%, is not a small number, in my opinion. But also it gives you some insight into the rapid onset, right? This is a 2 year period. So, sometimes when cat owners in particular skip that visit, they don't come for a year. So now we've got a 2 year gap. You can see they can go from very, very healthy to having a very serious health threat. And, again, obesity is always going to be my passion, but when I look at all these other diseases, it's like, wow, we need to do a better job, and screening is part of that for sure. And again, there's a note here. When they were screening for this, they did point out, that obviously non-thyroidal illness affected their free T4 levels for sure. So they had to rule out kidney disease and so forth. But I thought it was fascinating. Again, you can't just do one test and say that's what it is. You really need the trifecta of the free T4, the total T4, and the TSH. That gives you your most precise diagnostic capability for that, for sure. Again, this goes back to that paper. Ashley Wood and Bonnie Bragdon were on this. Of course, Mark Peterson was who they were working under at that time. But this is when they wanted to match up and see, okay, how good is this technology? So this is when it's all being launched and rolled out. And this is a paper that evaluated it. And again, really, simple paper, just matched it up with known reference labs, and it matched up perfectly. These results suggest that due to the enhanced sensitivity, improved detection limits enabled by the BAW, or the bulk acoustic wave biosensor, serum TSH concentration can be utilized to distinguish between normal and hyperthyroid cats. So they were just saying, hey, look, this stuff is accurate and precise, and we think you should take a look at it. So again, dig into that paper. Zomedica, I'm sure, can provide you with all of this stuff. Again, getting back to that TSH, which I think is the one assay that we don't think about enough in cats, and we should. But again, this is just telling us what we should do, how we should interpret it. And really, I kind of, this is the one area that I've gotten on a little bit of a soapbox the past several years, maybe the past 5 or 6 years. And that is when we talk about iatrogenic hypothyroidism in cats, because a lot of us do treat them still with methimazole, and there's a lot of potential issues with that. And so when we talk about treating hyperthyroidism, we know that that's then going to knock down the GFR, and that's going to quote unquote unmask the underlying renal disease. It was already there, but again, the blood pressure, especially that going through the kidneys, was masking it, hiding it. So you didn't see those net changes in those analytes. Now, what we know is that when we start to treat with methimazole, especially in the general clinic setting, we can get into iatrogenic hypothyroidism, and that it's more prevalent than we once thought. And so there's a couple of good papers here, again, from the past 4 or 5 years. I'd like to make sure they're on your radar. And again, I'm sure Zomedica can help you get whatever you need if you'd like to. But basically, when you look at the conclusions, about 20 to 50% of all cases that were treated with methimazole were developing iatrogenic hypothyroidism. And we're missing that, guys. We're just totally missing it unless you're doing TSH assays in combination. So we really do want to do that because that decreases survivability. So now if you've got that case that had hyperthyroidism and you treat them and they start to have CKD, and then they get into iatrogenic hypothyroidism. I mean, survival time decreased by 50%. So this serious consequences. So we want to just monitor, do a better job. We can. We can do it in clinic, affordably, timely. That's why I like this stuff. I do want to just briefly mention heart disease because this is a new thing for Zomedica. I am super excited about this because just being able to add NT-proBNP into my arsenal in clinic in a few minutes is again revolutionary. I mean, I can't say enough good things. I will say in the early days, it took a little while for me to completely accept pro BNP, right? And I think that certainly the testing methodology has gotten a lot better. All right. So first and foremost, in the early days when we kind of go way back, yeah, okay, there's maybe some questions, but it is such a solid biomarker. It is one of those things where literally now, if I'm seeing or being asked to consult on a case, especially with an obesity case, and they're talking about cardiac dysfunction disease, the first thing I'm going to ask is, okay, can I see the proBNP results? Because that's going to give me a tremendous amount of insight into damage to the myocardium. So just again, this is amazing that we can now do it in clinic at a very affordable, competitive price. So again, you guys know this indicator of heart disease or heart failure. But here's I think an interesting from one of the papers that was evaluating sample stability, easy determination in laboratory, sensitivity, accuracy, and the possibility to analyze myocardial function. Those that's about as succinct as I can get the key attributes. And do not undervalue stability and easy determination. Guys, that is really critical when we're selecting biomarkers to kind of become the foundation of our diagnostic protocol. So it's got to be something that's very reliable, very repeatable, very precise and accurate, sensitivity and specificity, right where we need it to be for sure. And again, we do need to look at a lot of these DCM cases. I mean, I'm not going to, again, convince you, but this is one more reason why the TrueForma platform makes sense to me in general practice, because again, I can get it done within that appointment, which is great, reduces anxiety, because when you hear that murmur and you tell the client that, let me tell you, the clock is ticking for you to give them answers. And if you don't give them answers quickly, they will go to another vet. Guys, I've seen this so many times. And if you don't believe me, I tell people, if you don't believe a veterinarian who's giving a presentation on some client issue out there, just go to Facebook, just go to TikTok, just go to Reddit, and you will see a plethora of complaints. And a lot of them will be the scenarios just as I described. So again, really good paper there in Vet World, sort of a review of all the proBNP, and helps you understand it better. Again, just talk to Zomedica. How does it match up, though, against what I would consider the gold standard, the cardiopet test from IDEXX? Well, these are a couple of plots here that kind of show that. And if we kind of, break them off here, you start to see when they match up, down here is going to be cardiopet and over here is going to be TrueForma. They cluster very tightly. So this is very good stuff. And again, this is where most of your cases are going to lie. So that's obviously why the test, has more data there. But those clusters are much tighter, as you can see. When you start to get into some extreme outlier conditions, obviously both of them start to have, you can have discrepancies and questions, right? But those are outliers that we can't predict, and we don't even know how to make them. But they do line up very, very well up and down the axis. So again, if you're concerned about precision and accuracy, how it matches up with the reference lab, in this case, head to head with Cardiopet, again, you can see clearly that these two things are closely approximate. So I'm very pleased with that. People always ask, questions, and again, I'm not a cardiologist, but when you look at the literature, these thresholds are pretty, that old 500 level that, we kind of all joke about, it holds true. And with the more research that comes out, especially longitudinally, these values are real and they're stable. So I think we're in an era now where even if you look at Zomedica TrueForma's sort of guidelines for that, and they're saying, hey, if it's 900 to 1800, that could be, when you look at some of the other research out there, you realize this great certainty. I mean, so I love the fact that we've gotten really not settled science, because I don't know that you ever truly settle the science, but we've settled pretty close on these numbers, despite, now decades of a couple of decades of looking at this analyte. So I'm a big fan of that for sure. So take a look at it. Adrenocortical diseases, again, a little bit of a passion play for me because of my work in obesity. So if we look at, again, Cushing's or canine hyperadrenocorticism, this is a great opportunity to do this in clinic quickly, reliably, and at a value. I mean, again, all these things just keep matching up to me. If I've got that dog in there who is 20 pounds over their ideal or normal weight, and suddenly, I'm saying I'm concerned about, a hormonal imbalance. Maybe I just want to look at inflammation. Maybe it is Cushing's, right? I mean, all those things, I start to realize, wow, I can now do this in clinic and it's not that expensive. And guys, I love when we talk about ACTH and cortisol in particular. I mean, there's so much research out there that we're just beginning to tap into. And, again, I'm super, super excited. This is a couple of interesting studies from RVC out of the UK a few years back, and just really looking at, thousands and thousands, 210,000. These are medical record searches, review papers. And, basically, obviously, hyperadrenocorticism is low incidence, but of course, when it happens, it happens. And again, so older dogs for sure. And of course, there was a correlation in this paper, as many others, with excess body fat. So, all that's interconnected, and it's good. Now, Addison's is one of those areas where when you want to diagnose it, you want to diagnose it quickly. I mean, these are often urgent situations. And again, I love the fact that we can reliably, not just looking at electrolytes like we used to do. We're very clever. Look, back in the day, I mean, we got clever with what we had, but now you can be so much more precise. And again, it's done in 20 minutes or less. And so you can give that answer to that client who's waiting desperately, because these are often scary cases for sure. And again, just talking about, how you rule in or rule out, and the values are pretty solid. That's that ACVIM paper that talks all about Addison's disease, which, if you want a refresher, that paper is actually a really good start. I mean, I think it's a good primer, a lot of good basic physiology and pathophysiology around Addison's, in my opinion, at least. Cortisol, guys, I keep saying it. I think this is one of those untapped, and I can tell you at the Association for Pet Obesity Prevention, there's a couple of initiatives that we'll be, bringing out sooner than later. I mentioned the textbook. I mean, we have, a lot of text devoted to these types of hormones in obesity and the pathophysiology that it creates. So again, I'm a big fan of it. There's an interesting paper that came out a year or two ago that actually looked at single post 24 hours hospitalized critical care patients. And they actually just said, let's look at what biomarker might be a signal for, mortality. And cortisol was actually really good for prognostic indicators. So these dogs that were spiking 24 hours post, were really at greater risk for death. Now, obviously, that's a big, wide range, but it's a key indicator of systemic inflammation, and that's really why they were investigating this. So it's a really cool study for sure. That's this one over here, and again, that's Yuki, and I don't know any of those researchers personally, but I do know that is a fascinating paper and one that's probably worth a little read for sure if you're interested in that. As we kind of wrap it up today, certainly we got GI disease and pancreas, very, very critical areas. Again, I do think there's a bit of urgency for these cases. So this is perfect. It matches up great with my personal practice philosophy of being able to solve those problems during the appointment. And so, again, not having to go home and repeat and so forth. So I'm a big fan. Again, CPL, widely established, well accepted, great marker for pancreatitis for sure. So I'm a huge fan of that for sure. Cobalamin and folate. So again, if you're looking for SIBO and things like that, those are tests that you can do and get results back while they wait. And these become important to me for this follow-up care, because now literally they can go, hey, go grab yourself a cup of coffee, hang out in the lobby for a few minutes. Let's get this done. We should have the results back in, 20, 30 minutes max. Is that something are you able to wait on that today? If not, we can call you. However that conversation goes in your clinic setting. But let me tell you, most folks will stick around. They're like, oh yeah, 20, 30 minutes. Yeah, I'd be happy to do that. Now you got to deliver on that. That's a whole nother question, and a whole nother debate, and a whole nother presentation from Zomedica. So Zomedica, I'll be happy, but you do have to deliver on that, and you can, and really the mechanics of that, Zomedica, just if you're watching, that's something that I guess I've given countless lectures on, just that workflow, right? How that works, who's doing these tests. I mean, that might be something that if you're interested in, definitely let Zomedica know. I'll be happy to give some of those presentations. And then the final new thing, a lot of folks have been asking about this, and I'm so happy that Zomedica is able to deliver on this, and that's canine progesterone. So a lot of my colleagues, a lot of my friends work with breeders, good, responsible breeders, and this is one of those needed tests if you're gonna be breeding, right? And so you got to be able to track that LH surge, and this again allows us to do that. So this is not an area that I do a lot of work with, but I have many good friends who do, and this is a real asset. I mean, this is something that these vets love. They're going to be able to do it in clinic. I mean, just solve a lot of pain points for a lot of folks. So well done, Zomedica, for bringing this to market. These are not easy things to bring to market. I mean, it takes a lot of R&D, a lot of validation, a lot of manufacturing, expertise. And again, what I like is that Trueforma now, it seems like they've got the platform down pretty solid, and now they're just starting to add on the layers, and that's where it gets exciting as a veterinarian watching this from afar, because it's like, wow, we know that there's some amazing assays and analytes out there, but they're out of reach from time perspective or difficulty to obtain, and maybe they're not even that stable, right? There's a lot of questions and cost, all that stuff. Suddenly now, people like Zomedica are saying, wait, we can actually do that, bedside, if you will, in the exam room, which, oh man, it's amazing. So again, they got tons of that. As I mentioned in the intro, also, again, educating ourselves and our clients, that's one area that Zomedica has really done a fantastic job. I mean, they've ramped up their efforts at how do we educate veterinary professionals. And so their staff education programs really are unmatched. Obviously, today is just, one example of that, but there's tons of resources, the literature on their website. And I will say this, if you are not finding what you want or need on their website, just reach out to them. They have been incredibly accommodating. I mean, I've had to pass many vets off over the past few years to them, and they've delivered every time. It's quite remarkable. So again, my hat's off to the good folks at Zomedica, because they really are interested in helping vets succeed. It's remarkable. It's a good sized company. It's not this massive behemoth where you kind of get lost and you're just a number. It's real relationships, personal folks, identities that you can relate to, and really a lot of their staff, they've been there, done that. And so it's a really interesting company for me. I think it's a good size. Obviously I know every company wants to be bigger and bigger, but right now, boy, I'm loving everything that they're pulling out there. So as we wrap up today, I want to leave you once again. This is really the foundation for you succeeding in anything, whether it's adding Trueforma, whether it's adding endocrine testing, whether it's anything, right? I don't care if new drugs, new equipment, new test, you really want to say, does it fit within your culture, your clinic culture and your client culture? Do you believe in it? Is this something you're passionate about? I mean, the reason I had so much success with behavior and nutrition, especially in the late 90s and early 2000s, was because I believed in it. And I still do. I believe that of all the things we can do to improve the health and longevity and quality of life for the dogs and cats and horses and rabbits that we serve, it's keep them at a lean body composition, right? I mean, so I believe in it, and therefore I acted upon it. And these are those areas, right, that you need to lean into. And there's a whole lot of you out there that are brilliant endocrinologists, right? You're GPs, but man, it's your jam. And these tools allow you to excel and thrive in ways you could never imagine before, right? You got to also say, does it match up with my clientele? Do they want it? Will they pay for it? Is this a good investment? Can I pay for it? Right? I mean, is this something that I'm going to be regretting that purchase a year from now, like so many vets with color flow Doppler ultrasounds, back in the day? So I don't want it to be a bad investment. I'll never, there are a lot of vets, I might talk to you about this and it's just not a good fit. And there's going to be a whole lot of you that I'm going to say like, oh my gosh, this is going to change the way you practice. And then finally, how are you going to execute on it, right? How are you going to implement it into your price, into your strategy? What's your pricing going to be? How are you going to promote it, right? You got to have some machine behind it to let folks know that you have it. I don't think it's good enough anymore just to tell your staff. You got to tell the public. And then you really do need to monitor and track it. Like how many of these are you doing? And again, I kept going back to, this is just basic business plan stuff, right? Just implementing in a smaller fashion. But these are the things where you want to start tracking at 90 days, at 6 months, 9 months, 12 months, and then maybe every 6 months, for the first couple of years to see if it is working for you. And if not, can you make some adjustments to some aspect of it, whether it's pricing, promotion, education? I mean, there are a lot of levers to pull when it comes to that. So that's it for today. It's a great conversation. I love this stuff so much. Our pet parents have a lot of wants. They have a lot of needs. They demand sometimes, but they deserve our best effort. And this is one of those tools that allows us to be our absolute best self. And so again, I want to thank Zomedica and Trueforma for sponsoring this talk today. It's certainly, this kind of technology just is my jam. I love it so much. And again, hopefully there are a couple of nuggets in there at some point throughout this presentation that, inspire you to maybe look at your practice a little bit differently. So that's it for me. On behalf of Zomedica and Trueforma, thank you so much for watching.